My name is Norm Volsky, your host, and this is the Digital Health Heavyweights Podcast. Welcome to the Digital Health Heavyweights Podcast with your host, Norm Volsky. And today I'm honored to have the Chief Revenue Officer of Lyra Health, Sean McBride. Sean, welcome to the podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years, and this feels like a sort of fun capstone moment.
Yeah, it's great. So you're coming to us from Madison, Wisconsin. Beautiful place to be this time of year.
That's right. Today's starting to feel a little bit like fall, which I have mixed feelings about.
Yeah, it's a nice time of year, but you know it's around the corner, which is tough. I get the same thing in Cleveland, so just got to enjoy it and stay in the moment. And yeah, we'll survive winter like we always do. So I'll dive right into the hard hitting questions today, Sean. You have an interesting career path. A lot of folks that, know you might not know that you started your career in politics. Can you kind of walk us through how you found your way into politics, working for Senator Russell Feingold and Governor Jim Doyle earlier in your career?
Sure. I was always interested in the work that I do, feeling like it had a social impact. And when I was in college, politics seemed like the most obvious place to try to do that. And I went to college and grew up in Wisconsin. And so really honestly kind of hounded first the senator and then the governor to sort of beg to work with them. And so Governor Doyle, for example, I ended up my senior year of college spending 3 days in class and then 2 days driving around the state of Wisconsin doing what is called external affairs. So I would get to different places that the governor was going to be that day and help make sure that it was ready for him to, give a talk in front of a fire station or whatever it might be. And really enjoyed in many ways working for both the senator in DC and the governor here in Madison, Wisconsin. And I think it sort of set me on an early expectation that things change all the time at work. Whatever you're working on is going to be flipped on its head moments later. And so started to develop some muscle to expect that and roll with it.
I love that. And what eventually inspired you to move from politics into healthcare?
Yeah, I was working in Washington, D.C. for the Brookings Institution. And I was there at a fortunate time, or maybe an interesting time in U.S. healthcare, in that it was the lead up to the Affordable Care Act. And when I was working at Brookings, one of the things that I ended up getting to help do is create something called the Brookings Dartmouth ACO Learning Network. And that was an organization, a nonprofit it became, that we would create content and bring experts to help health systems and insurance companies think about how to move from fee-for-service into different value-based payment models. And I found myself loving, the work in healthcare, and really just sort of got immersed through that in both healthcare policy, but also working with health systems and insurers and thinking about how they structured their payments and their contracts. And really the complexity of all of that kind of hooked me on healthcare, and that it was something that I felt was intellectually interesting and challenging, and that I would never learn the full extent of all of the nuances of the healthcare system. And sort of in the same vein of politics, I felt like I could hopefully do something that would make a difference in people's lives.
So walk me through from that time through starting at Lyra, like how you kind of found your way to Lyra and into the startup world, coming from politics, where I can't think of a bigger institution, to, when you joined Lyra, I believe they were pretty early on.
Yeah. So I had started this ACO learning network, and I found myself in that work loving the building of this nonprofit much more. I enjoyed this sort of econometrics work and the policy work. But I got so much energy from getting health systems to see the value of what we were doing, sign up for it, participate, and think about how we would grow that organization. And that really just gave me a bug for a desire to build something. I thought it was just so neat that I could look back after the first year of the ACO Learning Network and say, wow, like this didn't exist before. And we created something that people are finding valuable. They're paying for it, they're participating in it, they're learning from it. And so that really kind of gave me a bug to want to go try to do something else where I got to be a builder. I ended up going to graduate school and getting an MBA and a master's in public policy. And in that experience, got to become friends with classmates. And at a dinner, we all shared uh, our own experiences trying to find therapy at different points in our life. And I had been a little embarrassed and assumed my experience of struggling with some mental health issues and trying to get help and how hard that was both sort of a weakness of mine, an unusual thing. Most people, I assume, didn't have that experience. And I just thought I gotten lucky and how hard it was to find mental health care. And so I reached
Mhm.
out to somebody that I'd worked with at the Brookings Institution, to say, hey, I think there's an opportunity in mental health care to help better match patients and therapists so that we don't have to struggle to go through multiple therapists until we find the right fit. And the person I'd worked with in DC had become a venture capitalist. And he was like, Sean, the timing is funny of when you're calling me. Like, I am going to invest in this wonderful, extremely talented guy who wants to start a company in mental health care. And why don't you fly out to San Francisco and meet him and see if you guys would want to work together? And so I did that. I flew out to San Francisco, and that was David Ebersman, who is our CEO and co-founder of Lyra,
Mhm.
and was just really fortunate in the timing and it being an area that I was really passionate about.
And who was the venture capitalist that made the intro?
Bob Kocher. So I'd worked with Bob Kocher and his wife Cindy Chen at the Brookings Institution and at the White House, and so had gotten to know them really well and consider them dear friends. And so it was really fun to also get to work with somebody like Bob, who I just really respected and still respect a lot and care about on a personal and professional level.
Great. Yeah, no, Bob's awesome. I'd love to have him on the podcast one day. He'd be a phenomenal guest. So we'll see. We'll get there eventually. In terms of Lyra, if I'm not mistaken, and I did my research correctly, you joined about 3 months, or so before they got their seed funding. Like, what employee number were you?
I was either employee number 3 or 4, so it was a pretty
Wow.
small group of us. We started out building IKEA desks to set up our office, and so it was definitely Lyra Health was not called Lyra then. We were Patent Health,
Mhm.
we were Outcome Health, we were a number of different things, um, and really knew we were going to focus on mental and behavioral health care. But beyond that, didn't have had ideas, but didn't have much clear direction.
So from 2015, it was pretty much a cool idea that you and the small team were working on. How quickly were you able to, get it to the point where there was something to sell and you had a product?
The answer is about, well, at least in getting somebody to pilot something was early to mid 2016. So it's about a year
Okay.
of work.
Mhm.
Um, I think a couple things that are interesting in that period is one, like getting to something to sell, you don't actually want to overdo the investments in technology. And
Mhm.
engineering and R&D is like a scarce resource. And so getting something to sell can oftentimes be sort of the concept of the technology and the impact, but really a lot of humans,
Mhm.
working hard to do it. The other funny thing there is I remember so many people at the time over that first year of Lyra, so many people, there weren't that many people, but a lot of the company at the time, whether it was 10, 12 people, by the end of the first year or something, really felt like we were moving too slow. Like there was
Mhm.
this concept and this disconnect and this feeling that like, God, we're just not moving fast enough. We're not doing enough. And then it was just kind of funny that, when we get sort of 2 years in, our investors were like, wow, we haven't seen very many companies like get to market and create a product this fast. And I just remember being in a board meeting and feeling like, what a funny sort of disconnect that there was a sense of
Mhm.
frustration for a lot of people that we weren't moving fast enough. But then people who had pattern recognition and had seen these kinds of stories before, thought it was fast. And I always kind of held that in my mind that it's easy in moments to
Mhm.
kind of feel like, oh gosh, this is not right, or there's this and that, and to know moments pass and to try to keep perspective.
Yeah, I love that. So walk me through those first handful of pilots and then first handful of paying customers. What was the sales process like in those first handful? Was it like all hands on deck, you and David and everyone else at the company rowing in the same direction? Or were they like, all right, Sean, it's your job to sell them. Good luck.
Um, it was not that. In that, I think when you're selling anything in the beginning and trying to go to market, like it's a full pretty much a full company effort. Certainly, David and some other co-founders were really integral, like Dina Bravata, and getting early pilots. And it was a sort of discussion at the board as to whether you do free pilots or whether you ask for money for pilots. And in neither situation was it about like, oh, we need to make profit on these, but there was a sense of like, gosh, if people pay, they actually value and will like be collaborative with you and want it to be successful. It's easy to say yes to something that's free. We ended up doing free pilots. And part of it was just the amount of time and effort that the pilot partners were sort of putting in at the beginning made us feel like, okay, they're not just like saying, cool, go do this and not investing in it. Like they are devoting people and resources. And so the money didn't feel that material and more just got in the way of us learning. We really didn't know how we wanted to sell our services. Like the product we were building, we knew we wanted to solve some pain points. We knew that access was an issue, that people weren't able to find and start care. We knew that people were oftentimes starting the wrong care and then dropping out of care, and that a lot of mental health care actually isn't effective. And by effective, I mean there's not measurable symptom reduction from what you're struggling with by the end of care. And so we knew we wanted to create something that made it easier for people to find the right mental health care that was going to be evidence-based and really work for them. But we had no idea sort of how to monetize that or bring it to market. And so we did pilots with a large health insurer. We did pilots with some primary care groups, and we ended up doing pilots with a public sector employer and a private sector employer. And all of those were all hands on deck, and all of them were honestly like largely networked. You're sort of, somebody who knows somebody, and you get an introduction and kind of pitch the vision and hope that you can find some people that are willing to sign up. And I think we had a good advantage in that David, our CEO, is experienced, well-respected, and the executive team at the time was a bunch of people that, had credibility. So I think it made it easier to say yes to an idea at that point.
Great. Yeah, it's always team effort. Whenever you're doing something new for the first time, I think now, if someone asks like what's highest priority at employers, I'd say mental health is usually at the top of the list, if not the very top, item. I'm sure it was very different in 2015 and 2016. What was the appetite for employers in the early years to onboard a mental health solution for their employees or for their health plan members or for their patients, on the provider side?
The stigma of mental health had been fading, I think, well before the pandemic. I think the pandemic sort of supercharged us into normalizing the fact that mental health is a real thing. But it was really fading already, and there were people talking about it. And so we rarely, not never, but we rarely, as we were talking to employers, got a sense of like, this isn't important. Maybe it wasn't rated the top thing, but there was a sense that it was broken. There was a sense that people were struggling. And so it wasn't super hard for us, I think, to get people's ear to be like, oh, mental health, like this is broken and we don't feel like there are very good solutions to it. Like we're interested, tell us more. I think there was more of a fear. There was sort of a sense that there was a problem and that better mental health benefits would be helpful from benefits leaders. I think their bigger fear was that the stigma around it would mean you could offer the best thing since sliced bread and people wouldn't use it. And that was more of the kind of, I think, early adopter kind of conceptual fear.
And what were the major successes that you had with clinical outcomes or specific clients when the team realized, and even maybe the customers realized, like, this has incredible value?
One thing is we were doing these pilots with different types of customers, and really we had an early our first sort of private employer customer in eBay, and they were doing a pilot with us. And the things that I think were really meaningful for them is we were doing a pilot, so like we weren't promoting the benefit super heavily. But there was I think three things that were really meaningful. First, they let us come to a wellness fair for the pilot, and I was there, and we set up our table, and we put our cloth down. We have our stress balls and our flyers and our pamphlets, and I think we had a game of giant Jenga to try to attract people. But to that concept of stigma from employers, I mean, even I kind of assumed, like in the middle of like a corporate campus, people were going to be uncomfortable walking up to a table and like asking to learn more about a new mental health offering.
Hmm.
And like we were swamped and people were
That's
fascinated by it.
amazing.
So that was, I think, just like the benefits team standing there and seeing that like there are more people around our table than every other table.
Hmm.
And we probably had the jankiest looking table. And so I think they were like, okay, wow, okay, this is something people are going to care about and want to use. And then we were able to show that we could get people into care really quickly. And we were, for the first time, able to bring them data to show if people were improving in symptoms. EAPs,
Hmm.
health plans, well, health plans had no data whatsoever, just how
Hmm.
many visits you had. And EAPs would say, like, well, this is the percentage of cases that were closed. But it was always such a funny metric because you could call, have one session, and then be upset and think it was bad. And then they would close the case and sort of present it as a success story. So I think there was like, the benefits team was also like, oh my gosh, like we have data to start looking at value in mental health in a way that we never had before.
That's really awesome. And I think eBay being like a first commercial customer for you was good in terms of the demographic. We're talking about Bay Area company. Most of their employees were probably in their 20s and 30s, if I'm not mistaken. And those types, that phenotype is probably more likely to try something new, try something that's a little bit more virtual. So I think maybe it was luck, maybe it was strategy, but you got a good first customer as a proof of concept. How much of that was luck and how much of it was very intentional?
Most of it was luck.
Yeah,
So,
I doubt
again,
that.
those early introductions where like an investor is willing to set you up with somebody who knows the CHRO of some company, and Lyra is headquartered in the San Francisco Bay Area, and so companies that were in our backyard, we just had a higher probability of having some connection to get an introduction. I think the thing you're right in many respects about the eBay demographics, but eBay is actually a pretty diverse company in terms of employee
Mhm.
type. And so they, for example, have a really large customer service call center population outside of Salt Lake City. And that's a different demographic set than a lot of the engineers and tech workers that are working in
Mhm.
San Jose. And I think one of the things that was moving to us and to eBay that this had broad applicability was that people of all ages and in different parts of the country who work for eBay were really excited about the benefit and signing up and using it. And I think that was really telling to us that, and our investors and eBay, that this is like, more than a narrow focus thing for a subset of people.
I've noticed as I've interviewed more founders as well as, chief revenue, chief commercial officer types, on this podcast and obviously talked to hundreds of these people, if not thousands over the years. What I feel I've learned personally in the last 6 to 12 months is just truly how impactful the right venture capitalist can be to the growth of a company. It's very simplistic for the uninformed to just say, oh, well, all VCs are the same. They're just writing a check and hoping for the best. But the best VCs are the ones that obviously invest the capital, but at the same time are bringing a ton of value on top of it, making intros, ensuring success, pretty much stacking the deck in their favor. That, the company they invested in is going to get every opportunity to succeed. And I think that's something I've learned as I've been exposed to more of the venture capital side in the last handful of years. And what a lot of, founders who watch this podcast or listen to this podcast, I think if it's a first time founder, they need to understand the concept of like all money is not equal, in terms of which venture capitalists are really well connected. They might not offer you the best terms, but they might provide the best value. Um, so I think, your example is a really good lesson, for a lot of early stage founders to learn, because it can be crucial and make all the difference in the world. What advice would you give founders or the first salesperson at like a startup when they're trying to sell their first customers and they're trying to, you know, crystallize their value prop? What did you learn from your experience doing that? Because obviously you did a lot of things well.
And a lot of things wrong. I think there is a sense when you're first going out and talking about what you want to do that you need to like have the prepared script. You need to map out your story. You need to like come in and you need to like give your whole spiel. Um, And oftentimes you're trying to hide that you're, really actually don't know what you're doing. Or, you think you have a plan, but you haven't tested it. And you lose so much when you're in the room and you talk for the whole 30 minutes or the whole 60 minutes that you get. And
Mm-hmm.
really, like, every kind of major structural innovation, meaning like how we've kind of offered the Lyra benefit, and we offer it in many
Mm-hmm.
different ways now, has all come from customers and employers saying, it would be really helpful to do it like this. And it wasn't our initial conception. And
Mm-hmm.
that's just an example of like the listening part is so important. And so it's challenging because, and I see this with new partnerships directors or salespeople when they join Lyra, or new customer success managers, until you really know something, until it's like just part of your DNA, it's hard to talk and present and listen at the same time.
Mm-hmm.
But the more you can listen, the better. Now, there's also the over-indexing of listening, meaning if you're going to go into somebody and you're just saying, I'm just here to learn, like, just tell me about this. Those can be helpful really early, but you're also not going to sell
Mm-hmm.
them because it's clear that you like actually don't have an idea to give them. And
Yeah.
so figuring out the balance of being like, this is what we understand the problem is. We believe we have a novel solution. Here's why we have the capabilities to do it.
Mm-hmm.
And then let them respond and have comfort in sort of the dialogue. And your job, I think, in selling it is to manage the dialogue in a productive way.
I think that is great advice. And I've been recruiting salespeople and sales leaders for 11, 12 years of my career, in addition to other positions, but that's tends to be what I've gravitated towards in my career. And then I've surrounded myself with others that, focus on other things. And I think the conception of what a salesperson is to anyone who doesn't actually do it is what they show you in the movies. It's like a slick talking, they got their three-piece suit, they got their Rolex, they're probably a little bit cocky, they're very type A. You don't really know what their motives are. It tends to be very like a self-centered, type of vibe when it's, in the movies or TV. And that's not what actually works in sales. And I think what I found really interesting over the last decade plus in this business is some of the very best salespeople. And I would put you in the top 0.0001%. Like, you and your team, I believe, closed 30 accounts before you even hired a second salesperson, at Lyra. So you and your executive team closed a lot of the first, keystone accounts at the company. And you do not come off as the typical prototypical salesperson like they do in the movies. So I guess my question to you is, what would you attribute your success to, and what do you think you've done and you've trained your team to do at Lyra that's truly different than what most people think of as what sales is?
A big enterprise sale is inevitably really complex and has a lot of
Mm-hmm.
different facets. You have to interact with a lot of different people. And to your point, Norm, like, nobody likes being sold to. And that sort of like, brash sort of salesperson, at least in HR benefits, I don't think works very well. And I think it doesn't work very well because if that's sort of your attitude towards it, you're not a good listener. And the thing that drew me to sales in the early days of Lyra that I just got so much energy from is you are helping somebody evaluate the company. And that is a really complex thing to do. For me to be good at my job and to help that company evaluate whether Lyra could be a good benefit, I have to know enough about almost everything that the company does. They're going to be
Yeah.
asking care navigators. They're going to be asking about our technology. They're going to be asking about our financials. They're going to be, asking about like how we recruit providers and like their quality and like what's customer success. Like, and so I was like, wow, this is so fun. I, like, as my job, have to understand every element of this organization. And then I can really think of selling as more of an evaluation partner, and helping try to find a partnership where an employer feels like this is going to solve a real problem for them. And I'm helping bring them the information to make that determination and that case. And so I initially called myself, my own title, as a partnerships director, and all of our salespeople at Lyra are partnerships directors. And it's a little like cheesy, I guess, but my intent of it was like, your job is not to sell. really. I mean, it is. And I think it's okay to be, I don't think anybody walks in the room and doesn't think we don't want a company to offer Lyra as a
Mhm.
benefit. We would be honored and excited. But like our job as a salesperson, as a partnerships director, is to be your partner in evaluating Lyra to see if we're the right partner for you and providing great
Mhm.
mental health benefits. And so I think that mindset and that ethos is helpful. And so I think if you combine curiosity, like a love of knowing everything about your business,
Mhm.
and being fascinated about other people's, desires and needs and pain points, and then sort of just not viewing it as a transaction goes a long way.
uh, Music to my ears. And I am a sales nerd. I read every sales book. I talk to a lot of salespeople and sales leaders all day. I would argue CEOs and founders are salespeople themselves because if they can't sell VCs to invest in them, they can't sell their first handful of employees, like David probably sold you, like, hey, here's my vision. Do you want to be a part of it? So these are the people I talk to all day. And I try to pick up little things from everyone and learn from the best of the best. And something you said a little earlier when I asked you the question, what advice would you give a founder or a chief commercial officer or first salesperson when you're creating your pitch and and you said you don't want to be too scripted. What I took from that is you want to customize your sales pitch based on the customer needs and the customer priorities. And that like incorporates the listening piece. You have a story to tell. You know the general bones of like how you're going to tell that story, and many people I've had on this podcast who I deeply respect, who I think are in that echelon of people kind of who are your peers, whether it be Julie Stadelbauer at Progeny or Manny Menendez, who was from Consumer Medical. They both told me and you told me that like storytelling's big. So have a story, but incorporate like things your customer is sharing with you into it, and don't try to go word for word. I think is really good advice, especially for a new salesperson, because they want to be perfect. They want to sound smooth, but that doesn't build trust. It might give you the appearance of knowing more, and you might have the benefit of the doubt because you come prepared thinking you know more than you do. But I think the other thing you mentioned was vulnerability. Like when you don't know something, be very open and honest that you don't know. If you're saying, hey, we have a good idea of what we're going to do, but we really want you to guide us on how we can help you personally, I think that authenticity is the true thing and vulnerability that builds trust. And without trust, it is very difficult to make a long term business transaction and business relationship, which enterprise sales is. So I think those couple of nuggets that maybe you take for granted, because probably a lot of it is just like how you conduct yourself, and probably some of that's innate. But some of those things are really important things that I think many of our listeners can incorporate into their day to day that really makes the difference from you're a vendor to you are a trusted partner. And the difference between those is light years.
Love everything you said, Norman. You just sparked a number of things that I feel almost obligated to add or clarify to what I said before. I don't want anyone to get the impression that like just wing it, like just
Mm-hmm.
go in and have a dialogue and like see what happens. I mean, we would obsess about the
Mm-hmm.
deck and the story and the flow of the story. We would practice. We would, I mean, it was an all consuming thing. And I can remember the big kind of first meeting where we were trying to turn it from a pilot into a real customer. I mean, the amount of preparation was immense.
Yeah.
That being said, if you go in then and think that like you have scripted out the hour and you're going to talk the whole hour, um, that's a problem and won't be a successful meeting. And so, and it's hard to prepare and then be willing to let the flow of the meeting be different than how you've been prepping. And so, I think both are really important. Like you can't wing it, but also if your assumption is the prep is going to be exactly how the meeting goes, you're actually going to miss a lot of nuggets and opportunities to learn and to listen. Um, I think the other thing you said about vulnerability is so near and dear to my heart. I try to lead this way. I try to sell
Mhm.
this way. And it's just like, we're
And
human.
you
So
hire
why?
that way. Like some of the people we've hired together, like that's what you look for. And that's what your team tends to look for. Like you do not have, in my opinion, that I know of a single person on your sales team that is the prototypical person you could cast in a movie.
I think that's right. It's a really incredible group of people who really care, and vulnerability is huge. I mean, A story to sort of bring it to light in our, it was 2015, and it was, I think it was World Mental Health Day. It was, it was a big mental health day, and I'm, helping start a mental health company. And so I think I posted on Facebook about, the importance of tearing down stigma.
Hmm.
And like 7 people liked my post. And I then started seeing other people's posts that I knew who told their own mental health stories on that day. And I was like, oh my God, like I have my own mental health story. I've gone through this. It's so moved me that I'm trying to dedicate my life to creating something
Hmm.
that would help people who'd gone through what I did get better access to care that works. And I don't have the courage to post that I've gone through this. And so I changed my post. I edited my post and I told my story. And, I don't know, then lots of people liked it. And it was like, people want vulnerability. It creates trust. It creates an opportunity to have dialogue and for people to share. And so then I started going in, and I still think it's like one of the coolest things about my job and about the job that Lyra gets to do. I get to walk into very serious, big, important, corporations, and I get to stand up in front of everybody and talk about how I used to have panic attacks and how that affected me at work and what my mental health journey was. And I
Hmm.
can't tell you, especially in those early days, the number of times that either in that meeting or right afterwards, the benefits leader or, somebody on the team would reach out to me and be like, you know, I have a story. Or, one of my
Hmm.
family members is going through something right now, like outside of this sort of business transaction. Like, can you help my son, my daughter, my spouse? And I'll never forget one meeting. I will not say the person's name, but like a benefits leader, I finished my story and she just responded. She's like, "Do you mind if I tell mine now?" And then we all went around the room. There was like 6 of us. We all
Hmm.
went around the room and told our mental health stories. And when that's how the sales pitch starts, like the dynamic is just different. Like, okay, we all agree that this is important. There's a problem to solve. Like, let's see if, we think this is something that can make a difference for you and your company.
Yeah. There is a strong link between highly ambitious people and stress and anxiety. So, most people that achieve a certain amount of success most likely deal with a lot of pressure they put on themselves. Pressure makes diamonds, but you got to maintain your mental health to be able to maintain the success you're having. So, I think there's a strong alignment, and you're certainly not alone. I've had stress, I've had anxiety, I've had depression at times. But you seek the help you need, and there's no shame in that. So really appreciate you showing your vulnerability because it sets the tone and allows others to, which is great. Um, I think the digital health space is very unique. So being the first salesperson at Lyra, now the chief revenue officer running the whole sales function for a company that's valued at $5 billion plus. What do you think the keys are to building a great go-to-market strategy specifically in this space?
First, Norm, I just want to say thank you for sharing that you've gone through your own mental health experiences and for acknowledging that performance and mental health oftentimes go hand in hand. I actually think that there was sometimes we'd run into this stigma, sort of like, are we trying to retain the people that are struggling with mental health issues? And, I felt like getting to bring my story to the table. I'm somebody who went to fancy schools, I've worked in fancy places, and to sort of share that I felt like was important also just to pierce sort of this uh, untrue concept that like mental health issues happen to people who are weak or not performing. Um, and
Like,
man,
look at
that,
Simone Biles. She's a
yeah,
world-class Olympic gold athlete. Like Kevin Love, NBA champion, potential Hall of Famer. Like people really
too.
successful can still have issues, and like most often do.
And for other founders listening to this, there's a lot of research that's been published that founders have mental health issues at way higher rates than the average
Mhm.
population who has mental health issues at high rates already. And like I view Lyra as almost like I don't know, I'm part of Lyra, Lyra's part of me. I view it
Mhm.
as part of my DNA, and it's very hard then to not to how to separate yourself from the business and how it's going. And as you grow and you get bigger, valuations aside, it's like people. Like there's so many people now who work for this company, people who get their mental health care from this company, and so how to manage that anxiety and stress as a company gets bigger. It's sort of funny. I thought in the early days, gosh, like once we sort of get product market fit, it'll get like less stressful. I kept thinking there'd be like some level where once I got
Mhm.
that, like, then hey, even if some stumbles, like I've helped achieve this thing and I'll feel pride and that won't stress me out anymore. And it's amazing how like the stress and the pressure sort of builds every year as opposed
Yeah.
to like feeling satisfied with it. That was a bit of a tangent. You had asked about building a great go-to-market strategy in digital health. Um, I think the first a few sort of thoughts outside of team is I mentioned earlier that we did a bunch of pilots with different types of customers.
Hmm.
Um, and I think the thing we honestly, we learned who we thought was the best customer to go to market with for us, which is employers, and
Hmm.
that was a huge learning. But the other learning of it is like actually we couldn't serve all, like let's say all three or four of the different kind of potential customer types we felt like were good for us. We couldn't have served all three or four at once. Like,
Yeah.
so really having a lot of focus, and sometimes that means acknowledging you're going to try a bunch of stuff and learning, but having the focus to know, like, we're going to say no to stuff. So, I mean,
Yeah.
we do things that I think in terms of creating focus that a lot of people would have been like, wow, like, are you sure you want to do that? Like, we told one of the largest health insurers that we were doing a pilot with that we were ending the pilot. Like, we didn't want to work with them anymore.
Yeah.
And, they're amazing health insurer. It's like nothing. It was just like, we need to focus on the employer market where we see that we can make the biggest impact, at least in the
Yeah.
next, 5 to 7 years. And so that focus, I think, is huge. I think the other thing is people have this like appetite or desire to sort of like create a new category. Like we're going to create
Hmm.
a new category. And therefore, like they're generally trying to get people to pay for something that didn't exist before, which like, hey, if you have a truly like novel, crazy thing that creates value for people that truly didn't exist before, like go do it. But like our
I use the
strategy,
musculoskeletal, like remote physical therapy as an example of that. Like people were willing to buy it really damn early because like it just
yeah,
made business sense. There's a couple of those. Other than that, yeah, you kind of have to ease your way in.
and even like the MSK players, like it is a different format and a different way of getting something that was known to work. So it wasn't like,
Mhm.
hey, you've never heard of musculoskeletal support
Oh
before. You
yeah,
know what I
like
mean?
through physical therapy. Now we're just
Yeah.
doing a remote. 100%.
Yeah.
percent
And so I saw a lot of people in the early days of Lyra going to market and sort of saying, hey, employer, you didn't know you need this whiz bang app. Hey, employer, you didn't. And it was always an extra thing. And
Hmm.
so I feel like part of the reason we thought employers were a good fit for us was one, we thought through the value of each of the different customers that we were serving, and employers we felt like had the most value. They not only could, hopefully help get people healthier and manage total medical cost, but there was retention benefits, there was productivity benefits, there is just the attraction of offering a benefit, in terms of
Hmm.
attracting talent. And so we're like, okay, the value that we could share with employers is bigger than some of these other channels to start. Um, and and they are paying for this stuff today. So there
Hmm.
is wallet share that you can shift that you don't have to like come up with as an additional thing to go justify. And so I think being able to replace an employee assistance program was one of the most sort of
Hmm.
foundational things that gave us lift relative to other mental health companies. A few other things just in sort of like building it is, you asked were the founders, the other founders and executives involved in the early days. There is no way to develop a go-to-market strategy, figure out how you want to frame your offering, learn the next thing that you should be building or how to enhance it if you're not in the field. I
Hmm.
can't, like, I'm in the field every week still, like talking to our prospects, our customers, and learning that to me is just like the most foundational thing you can do. And so for some founders, they're going to be like, sales is where they get their energy and they might over index on it. For the ones who don't, I would just encourage you to push yourself to be in that. I can't
Hmm.
tell you how many times I have heard something in the field and I try to share that with others in the organization. And they're kind of like, yeah, okay. And then I bring them to a meeting and they hear it firsthand and they're like, whoa, we have to do this thing. And it's like the gift and the importance of hearing that stuff directly from your prospective buyer is invaluable.
I love that. You and your executive team closed approximately the first 30 accounts, and then you grew a team. And let's fast forward, 5 years from then. Now you've got, 30 plus people in the sales organization, plus I'm sure a lot of others bubbling up. to you at CRO, you've hired an amazing team, like a top performing team. You've scaled it. What did you look for in the early years with a couple of your first key hires? And like, what have you learned through that process to like what your ideal hire looks like today?
Well, you've been an important part of that journey, Norm. So thank you for helping us
It's been a fun
bring
ride,
us
Sean.
some talent. Yeah. The early days, I was looking for people who had all of the assets that I was, and this is like hard and awkward. I felt like I kind of had to look in the mirror and be like, hey, I've been pretty good at this. And like,
Hmm.
why? Because when you hire, especially those first people, I'm like, okay, what has made me capable at this, and how can I find that in somebody
Hmm.
else? So it is sort of a weird kind of egotistical, like look within yourself kind of thing. But it was, trying to think of some of the traits that I talked about before, like people who were just, well, some of the early hires, I think it's really important. If you've been in a role at big companies or you've done like sales before, it's pretty different when there's like
Hmm.
you're the first or second or third sales hire. Like there is nothing there for you. There is no infrastructure. Nobody's getting you leads. Nobody's going out and nurturing the channel consultants, etc. Nobody's like creating decks for you, or like you got to do all of that yourself. So I wanted to
And a lot
find
of it's
people like
trial and error at the beginning.
totally, yeah. And so you have to be really, I think, so I wanted to find people that were really smart and who were able to do in a like sort of a general athlete that could do a variety of
Hmm.
different things. And so for a long time at Lyra, like part of getting hired as a partnerships director, you had to come and give us a pitch. You have to do a timed writing sample, and you had to do an Excel exercise. And because I was, I needed people who were going to be comfortable, even as we started building more machinery, of being able to like, get finances and be able to talk money and economics with a prospect. I
Hmm.
needed somebody who could, a lot of the sales process is writing. Like you have several meetings and then you're getting like reams of questions. You're getting an RFP. We did all the RFPs ourselves. And so you need to be like a good writer. And then it was that, communication piece. And then the fourth piece that, might be true in most companies, but I think is especially true in Lyra that you hit on before. I wanted people who like believed in the importance of mental health in their
Hmm.
bones and were just going to bring that authenticity and that passion to how they talked, wrote, and modeled Lyra for prospects.
That's great. And, I go to a lot of the conferences Lyra goes to, and I do notice Lyra is among the best cultures in the space. Like, there's a reason I stalked you regularly to try to work with you is because it was really hard to get people out of there. So I said, hey, if I can't beat them, join them. You do a great job of retaining really great talent. And I think a lot of that's building an amazing culture, and a culture that breeds a lot of success. So, like, how do you go about culture building?
It's something that as we've gotten bigger, I've thought more about. But I think you kind of hit on the most important thing in the early days. And it pays dividends for many, many years, I think, to come, which is just hiring people who have great values and that you
Mhm.
believe in, and that you think are good humans and that are going to be emblematic of people. It's like life is short. You want to work with people you like. And so bring
Yeah.
in nice people who are also motivated and driven and smart, but who are going to be kind. And because, and most of the early people I hired are largely still at Lyra, and many of them
Mhm.
now are in manager roles. And so as those people step into management roles, they're hiring people and they're bringing that same kind of ethos. And that honestly, it's just like seeding the team with the right early
Mhm.
people. They're going to go and hire other great people, and like that radiates out. And so it's really kind of managers and hiring people who share your values that I think is the most important thing to culture. As we've gotten bigger, I have to think about it in different ways. And I'm fortunate that Lyra offers the market a lot of tools to help with mentally healthy cultures, and we get to leverage
Mhm.
those tools inside Lyra. And so we call this suite of tools workforce transformation. But to give you some examples of like how we deploy that at Lyra, we sort of have an add-on to like an engagement survey that's specifically about identifying risk factors at work that could be negatively contributing to mental health. And so we did that survey this year. We have this cool dashboard. We get to look at it. We get to identify issues. clinicians from our workforce transformation team and organizational experts like then come and talk to us about like, hey, these are the results, and here's some things you could do, and just sometimes things are structural and harder. Sometimes things are easier. Like one of the things that I learned from it was that there was things going on where I was just kind of like, why? Like, why do
Mhm.
people feel the pressure to do this? Like, I don't understand. Like, I say no to this thing that other people feel like they can't say no to. And the leader of our workforce transformation team, Dr. Joe Grasso said something really important, that he was just like, sometimes it's really important to make the implicit explicit. And so
Mhm.
he's like, so you're doing this, but like a lot of people don't like get to work with you every day and see that. Like, tell the team that this is a norm, that is
Mhm.
okay. And so I think that's an example. The other thing is we have these cool courses that are about being, different sort of aspects of mental health at work, and we call it Lyra Learn. We came out with it Joe came out with the first ones and his team a couple years ago. And they're these bite-sized courses. And so we do them, and every quarter, everybody on the team does a course, and we have different ones for managers and we have different ones for individual contributors. And then we come cross-functionally together across what we call go-to-market. So my broader team is not only the sales or partnerships team, but channel, marketing, customer success, workforce transformation, and operations. And we all come together in small groups and talk about these courses that we did. And I think it helps create an opportunity for people to prioritize their mental health at work, talk about it with others, and normalize that. So I'd like to hope some of these tools too have been meaningfully additive to our culture over the past several years.
What you said that really resonated with me was how crucial those early hires you made were, which I had no involvement in. So, that I can't take credit there. But what I resonated with me is that I see it with myself and my business. So, like 8 years ago, when I was probably trying to pitch you Livongo because that was my first client in the space, and you're like, "No, I'm very happy here." Um, I was a team of one. Like I was just going out there and making mistakes, just like you mentioned, you in the early days at Lyra, just, meeting a lot of people and just trying to get the name and, the recognition out there. And if, people ask me all the time, like, hey, like, have you been successful, just in the recruiting world? And I say the same thing you do. I got lucky in certain respects. Like a lot of it was hard work. There's a huge impact of some of the early hires, like Mitch Herman, who was my first hire. He's my
Love
first
Mitch.
intern. Joined, 4.5, 5 years ago. If you include his internship, 5.5 years. And if it wasn't for him joining and I would have got someone else, like maybe we never get here. And by having Mitch, who just came in and like continued to set the standard, still had the same values, like lived, breathed, sleeped, like what I believe, that helped set the tone. And then we hired Tyler, and Tyler is now my chief of staff, and like he sets the tone for the team. And Trevor Yasna, who we hired 2.5 years ago, and now is a partner. Like with those folks leading, and some of the people who have joined since, like Chelsea and Gabriella, and Casey, who I joined the firm with around the same time, and she kind of manages some of these folks. Like without some really key people at the beginning setting the tone, you do those right, it's pretty easy to keep the culture for a long period of time. You get those wrong, you're going to be juggling nonstop for maybe the rest of your career. So, what I talk about with seed stage companies and early stage founders, and even into Series A, like the reason you're working with us is because those first key hires are so important. You get those right, you might not need me 3, 4 years from now. It's better that way than like you're coming to me when you're Series D and you're like, we got to revamp everything we're doing. We got to clean house. We got to start over from scratch. Like you halt progress. So that's how it resonates for me from my seat. Is I couldn't agree more. You get a great leader and founder and visionary, and surround them with the right talent who shares the same values. Like magic can truly happen. Which leads me to my next topic. You've worked with, in my opinion, one of the top visionaries and leaders in the entire space, David. Can you walk me through what you learned from David and your time, from 2015 to now? And from that experience, what you think are key traits of a founder? Because he's not like this very type A, very, exuberant personality. Like I met him briefly at conference board. He's very like laid back, low key, very like quiet. Like he's not what you picture as like the visionary CEO. So just am curious to see what you've learned from him and what you think are crucial traits that has made him successful and make others successful, regardless of personality type.
It's funny you say that about David. That was kind of my first impression of him was also like, wow, this is not exactly who I expected from somebody
Mm-hmm.
who was the CFO at Genentech and the CFO at Facebook. And I expected a more brash in your face personality. And David and I's first meeting together was an hour and a half walk. And we talked about books and like purpose in life and values. Um, and he has been just the most incredible person to get to work for, and I have all of the respect and admiration for him in the world, and it is one of the core reasons that I've stayed at Lyra is getting to work with him. Some of the things that I've really taken away from him, and I think some of these have cultural impacts to your previous question too, is one, he really understands the importance, I think, of transparency and context to empower people to do good work. So as an example, after a board meeting, David takes the deck that we went through with the board and strips out any like HR personnel stuff. Um,
Mm-hmm.
but the company essentially knows our financials, knows like what the board's focused on. David will tell them, and I'm in those board meetings, so he gives an accurate summary of like
Mm-hmm.
what the conversation and the discussion was. Um, and I really admire that. David's also just so deeply smart, and he's
Mm-hmm.
smart across a really impressive array of domains. And so the thing that I've loved about watching his mind work is that oftentimes people get caught up in like the details, like the fanciness of math or modeling or the complexity of this thing. And David has this amazing ability to sort of zero in on the so what. So
Mm-hmm.
like the implication, and sometimes it's like math comes or modeling or suggestions or whatever, and he's just like, I'm not like questioning how you did your math. The answer just makes no sense. Like it just makes no
Mm-hmm.
logical sense. And so like he's constantly like encouraging me through example to like step back and really think about things in a broader context. And that just sort of higher level thinking I find so impressive. And then the last thing that I think is a trait, and I think everybody has a different gift, like some people, the brash or more gregarious, like in your face CEO, maybe they have a gift of getting to like make people jump up and want to run a marathon or something. David's gift in a way is steadiness in terms of like culture. Like he just is
Mm-hmm.
able to sort of like absorb stuff and be like, okay, that happened. Like, how do we move forward? Like, what's the next
Mm-hmm.
thing we have to do? And there's just a groundedness in that I think is really helpful as you're trying to do something for the long term.
Couldn't agree more. I think a lot of the founders I've noticed that do really, really well are able to simplify things, take really complex things and be able to explain it to a 10-year-old logically in less than 30 seconds. So I think like that specific thing that you picked out, I've noticed is being a key trait of top founders, whether it's whoever in the space that has achieved unicorn status. And I would say this, people always ask, like, what sets Lyra apart? Why are they different from some of the other unicorns? A lot of the other unicorns, are really described as very intense places to be. Very, demanding cultures. Hey, you might have a short run there. It might only be 2, 3, 4 years because you might get burnt out there. And that's just, how things go. Still might be a great career move for you, but, I don't know if this is the place you're going to stay 10 years. I have noticed, like, you guys have super high expectations. You guys work your asses off. Like, you guys do all the things, but for whatever reason, from the outsider's perspective, it seems just a little bit less like intense and pressure and like burnout. Like I just don't see that at Lyra. And I'd love to maybe have you on the podcast again or have David and like maybe go a little bit deeper into why I get that sense. But I've noticed that and I think it's testament to your leadership and David's leadership. So I wrap up all of our podcasts in really getting to know you a little bit personally and your own like health journey. So, you've done a lot and your team's done a lot, your company's done a lot to help other people improve their mental health and improve, their healthcare across the board. How do you personally participate in wellness? Like, what do you do to exercise and best ways to reduce stress in a very stressful job? Like, you're responsible for hundreds of millions in revenue and hitting numbers quarterly for your board.
I something that I think you'll relate to, Norm. Things that have been very anchoring for me, and in part that I learned from a therapist, and sort of helping the connection of physical to mental health for me. A therapist that was amazing that I was fortunate to see in my early 20s. But one, I learned that exercise for me is almost more about my mental health than my physical health. So
Yep.
exercising regularly, it doesn't really matter to me what kind of exercise I do. It's like whatever just gets me active. I
What
like
do you kind of juggle between? Like, what are your
Yeah,
go-tos?
I used to swim a lot. Right next to Lyra's headquarters in Burlingame, there's a pool at a high school, but you can pay to use it. And it's an outdoor pool. And
Mhm.
so I used to swim there a lot of mornings before work. Now I try to run once or twice a week, and then I do like weight training twice a week. Um, and I'll get to maybe a little bit of why I've evolved that in a second.
You'll
Meditation,
need an indoor pool for
yeah.
Madison, unfortunately, between November and May.
Meditation has also been like a huge part of my life since maybe my mid 20s, and I try to meditate every day for at least 10 minutes. So I'm not over the top about it, but and it really makes a difference in helping me sort of separate from the noise, and everything that's going on. The kind of last thing is a balance of both being social and alone. I find being with
Mhm.
friends or family is one of the most distracting in a beautiful way. Like it is the
Mhm.
one almost surety that work will not be in my mind in the same way as when I'm with a good group of friends. And at
Mhm.
the same time, I also need some time just occasionally alone with like nobody asking anything of me. And so
Yeah.
finding each of those is important. I was like, all of that was blown up for me when I had my daughter Ophelia.
Yep.
I wasn't
Love the
sleeping.
name. I'm a big fan of the band. I did ask you, like, is it from the song Ophelia? You said, yeah, that might be part of it. So that's one of my top three bands of all time. It's them, the Allman Brothers, and I always have to go with Grateful Dead as my favorite. It's just
You have good
the way
taste
I
in
was
music.
brought up with my dad. But
Taste in music.
yeah, big fan of the name, big fan
Yeah.
of some of the inspiration.
But yeah, I've been trying to like find my way back to routines that are helpful for me. Just being sleep deprived and having the obligations of a parent, while amazing in so many ways, also kind of blew up my self care. And so, swimming was just more time consuming for me to go do to drive to the pool and whatever. And so I started running more. And you have to constant in life is change, and you have to figure out how to adapt with it. And sometimes it takes some time to do it, but I feel like I'm getting there a little bit right now.
And you're raising a daughter. Talk to me about healthy habits at home. Like, what healthy recipes are you and your wife making to make sure you're healthy and the baby's like getting a good start in terms of eating habits?
So I'm cooking is like a hobby and a passion of mine. And my mindset is like less, I'm not focused on any diet or it has to be this kind of thing. More, I just
Hmm.
feel like if I'm using like real good ingredients for things, like I'm not worried about the cheese to vegetable to meat to whatever ratios of things. I'm kind of like, if I'm just like cooking wholesome ingredients and putting them together,
Hmm.
it's probably good. And then for our daughter, we actually really don't stress about exactly what she's eating or how much of what she's eating. We kind of make food, and she has the
Hmm.
options of the different things we've made. And sometimes like she just eats all the pasta and like none of the vegetables, and that's how it is. But in a way, I think the lack of stress around like forcing her to eat something has been helpful. Like then the next meal she'll be like, I only want to eat broccoli, and we're like, okay.
Hmm.
And then she just houses broccoli. And so
Hmm.
I don't know, that's kind of the mindset. I've also had to, my wife has pushed me a lot. I love cooking, but it's also can be time consuming. And time is our scarce resource. And so I found a local kind of food meal prep delivery company that we get for 2 meals of the week to make it easier.
Nice.
Just because my wife was getting a little sick of me getting home cooking for an hour, her and me, so dishes and all that. So life's about compromise.
Yeah, and it's you got a busy job and you probably travel a good amount, so it's always good to have a little bit of convenience every now and then. Well, Sean, thank you so much for joining on the podcast and joining us, stepping into the ring for the Digital Health Heavyweights podcast. It's always fun to talk. I really just love your perspective, and I think a lot of our listeners who either are salespeople or are sales leaders or founders, that want to achieve similar success, which is very high bar. You've given great advice on what it took to get to where you and Lyra have gotten today. So again, thank you so much for joining, and thank you for our listeners and viewers. of the Digital Health Heavyweights podcast, and really appreciate Sean McBride, Chief Revenue Officer of Lyra, for joining us today. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.